I'm Dr. Robert Singer. I'm a board-certified plastic surgeon practicing in La Jolla, California, and I am Chief Medical Officer of Prime Plastic Surgery. When my dad had a heart attack, I was 11 years old, and his cardiologist acted as a mentor to me, and I decided I want to go to medical school to become a cardiologist. Once I was in medical school, I realized I had more of a surgical personality, and I went to Stanford to become a neurosurgeon. And in the middle of my residency, which was during Vietnam, I got drafted as a surgeon into the Navy. I spent time running the ER at Balboa Naval Hospital, and then I was sent to Vietnam. Once I came back, I had a request from the head of cardiac surgery at Stanford, a very notable cardiac surgeon, to come to Stanford to go into the cardiac program. I had spent a lot of time taking care of very sick people and in intensive care units, and I wanted to be in a specialty that I could see the results generally right after surgery, that especially that made most patients happy, and that had a little less dogma as long as you understood the basics of physiology and wound healing, and that was plastic surgery. And for me, that was the right decision. I've done all types of reconstructive procedures, and now I mostly concentrate on aesthetic procedures of the face, the nose, the neck, eyes. I've also done a wealth of breast surgery, augmentation, reductions, lifting, and body contouring. Safety has always been a prime consideration in my practice, and there are a lot of things that I have done to hopefully make the specialty better than when I came in. I developed the ASERF, which is the Aesthetic Surgery Educational Research Foundation, now called the Aesthetic Foundation, to look at new procedures and to look at safety and efficacy. I started the Emerging Trends Hot Topics Task Force for Plastic Surgeons, which look at all new procedures and, again, look at safety and efficacy. I've been the chair of the board of New Beauty magazine, which is the most prestigious of the beauty magazines worldwide, which looks at a lot of the new procedures and reports to the public. I monitor and have been a reviewer for the three main plastic surgery journals, so I see all of the new things that are coming out. Along the lines of surgical safety and outpatient surgery, the two boards of the main plastic surgery societies, ASPS and the Aesthetic Society, which we used to be called the American Society for Aesthetic Plastic Surgery, I convinced those boards to mandate that their members of the organizations only operate in accredited or licensed facilities, which was a huge step in improving safety for the public. I continue to do that. I have been involved with the International Society to try to do that on an international level as well. I realized that training other surgeons was key actually during my residency. We all learn from others, and hopefully we pass on that knowledge. And the legacy we leave is the younger surgeons who are coming in, and there are many young, bright ones who hopefully will take to the field to the next level and improve it. I think giving back to the community is a very key aspect of my life. One, it's the right thing to do. It makes your life better. It makes the community life better. My wife, who unfortunately has passed away, and I were very involved in many aspects in the community, in the arts, the La Jolla Playhouse, the Symphony, La Jolla Music Society, the museum in Balboa Park, the Mingay, but also in things like San Diego Council on Literacy, the Downtown Public Library, which was a huge project in San Diego. It took 30 years for them to get it approved. When my wife was head of the Library Foundation, she was able to raise $195 million public-private funding and got that through City Council, who originally weren't going to pass on it. And the day it was built, it was on time, it was on budget, and fully paid for. Before I speak about the future, let me speak a little bit about the past. Some of the notable things: I was fortunate enough to be president of the San Diego Plastic Surgery Society, the California Society of Plastic Surgeons. The most prestigious of the plastic surgery societies, the Aesthetic Society. And I was chair of the board of trustees of ASPS. In the future, I hope to continue to be involved in task forces and to continue to improve the level of education for plastic surgeons and the public. Spend time with my daughter and her husband, and take care of my cat, and, who has trained me, and hopefully continue to learn and educate myself. There's nothing I do in surgery today that's the same as I did 5 years ago. Continued improvements, and that's what I always want to do. I don't think there's one experience. I think it's a wealth of experiences that have brought me to where I am today. I think that the key thing in my practice is taking care of patients, and the philosophy I have is I'd like to take care of them the way I would a member of my family or staff. It's not good enough for them, it's not good enough for the patients. When patients come in, part of the process is the education through the interview and evaluation. In the past, patients came in, you were at point zero and you educate them. Now, with social media and the tremendous amount of misinformation, you have to spend a lot of time just bringing them up to zero to dispel the misinformation. You have to go over what's realistic, what's not, that the patients are involved. They're in their own care as well. They're a partner in that. They have to follow instructions. If they're unwilling to do that, then they shouldn't have surgery. I mentioned that originally I went to Stanford to become a neurosurgeon, and I discussed how I ended up in plastic surgery. But in reality, I ended up a brain surgeon because the emotional component and psychological component that a patient has is often far greater than the physical aspect of what the surgery does. So you have to evaluate that carefully and make sure the patients understand what can and cannot be achieved with surgery. As far as continued education, both teaching and learning, I've either presented and moderated over 400 panels or peer-reviewed articles in the major plastic surgery journals. I'll continue to do that. One of the things that I've just started is a task force about Medi-Spas. Medi-Spas are the Wild West that are unregulated, and this will allow development of a level of accreditation based on who's doing the procedures, what the procedures are, and what their level of education should be. That's a significant advancement forward for the protection of the public, because right now there have been numerous problems in spas because there's no oversight in most states. Part of that is evaluating who should and who should not be operated on. Not every patient should have surgery. Evaluating whether they're reasonable, whether they understand the ramifications of surgery, whether they understand that there is no absolute perfection, and are they good medical risks? Is their motivation correct? And if it's not, they're better off not having surgery. So I say no to some patients. I've seen a lot of events through the years. Historically, in internationally, politically, that have contributed to where I am today. And hopefully I will not stop learning. I've received many honors from my peers and organizations. The ones that are most significant, aside from being elected president of the national organization, is the fact that I was given the Career Achievement Award by the Aesthetic Foundation and the Aesthetic Society. That was only given to 8 plastic surgeons in history before me. That Career Achievement Award is the most prestigious award in aesthetic surgery. I was also honored with the Patient Safety Award. To me, that's the key. The foremost thing, no matter what else, is patient safety. I tell patients, if you're going to shop for bargains, shop for them on your t-shirts and your sandals. Don't try to shop for bargains on your surgery. I'm flattered to be included in Marquis Who's Who. That's one of the highlights that one could receive in a career, being recognized by them. That's a recognition by an entity that is well established and as a reliable, straightforward, honest entity, and I'm flattered to be included.